A thorough physical examination is essential before establishing a successful physical therapy regimen. A key element is the special physiotherapeutic examination besides the standard orthopedic and neurological examinations. We will now focus on specific physiotherapeutic elements. The therapist should examine the patient at a stance, at different gaits, and during specific movement activities. Weight bearing on the limbs. Often there is less weight placed on the lame limb at a stance. Flexion and extension of the joints. Weakness and trembling. Is the line of the back physiological or not, like kyphosis or scoliosis? Head position. A stiff head-neck position can, for example, hint to cervical disc lesions or the wobbler syndrome. And finally, body conformation. Muscle asymmetry can indicate muscle atrophy or swelling. Is the animal able to sit down, lay down, and rise to a stance? While sitting down or laying down, one pays attention to a smooth flexion of all involved joints. Pay close attention to the hind limbs while the animal gets back up. Does the animal have difficulty to place weight on the hind limbs? Is it difficult to transmit the weight to the front limbs? The gait is assessed while walking and trotting, while the patient is on a short leash and while the animal is moving freely. The examiner should assess the gait on different types of terrain if possible. The patient should be observed from all sides, for example, from the front and the back, right and left. One should observe posture during gait. The line of the back. Does the back swing freely in motion? Is lateral flexion of the spinal column increased or reduced? Is there more lateral flexion to one side or the other? Can any peculiar head, neck, or pelvic movements be detected? How is the tail position? Lameness is evaluated according to the standard lameness classification schemes. In addition to assessing the severity of lameness and classifying the condition as supporting leg lameness, swinging limb lameness, or a mixed form of lameness, special attention should be paid to the following criteria. Joint flexion and extension during the stance and swing phases of the gait cycle. Stride length. Foot position during the weight-bearing phase, under the body, lateral. Dragging of the feet. Proprioceptive deficits. The patient should always be walked and trotted in large circles, but also in sharp turns if possible. The above lameness assessment criteria should also be evaluated during turns. Turns are helpful in uncovering subtle signs of lameness or neurological deficits because the inner limbs receive more of the weight-bearing forces than the outer limbs. The limbs and spinal column are carefully palpated to assess their symmetry and general muscle condition, that is, to assess for muscle atrophy. Using both hands, each pair of limbs is palpated simultaneously to determine whether there are any differences between the two limbs. The examiner should proceed from the forelimbs to the hind limbs and then assess the muscles of the back. The following criteria are assessed: general muscle condition, muscle symmetry, muscle and joint temperature, swelling or hardening of joints or muscles, muscle tone. The examiner should begin by palpating the dorsal aspects of the scapulae to determine whether the two sides are symmetrical. Next, the shoulder blades are palpated and the condition of the scapular muscles is assessed. After assessing the scapula, the examiner should grasp a limb in each hand and palpate it from proximal to distal, starting at the shoulder joint, then arm, elbow joint, antebrachium, and finally the carpus. which is the European way, or from distal to proximal being the American way to do this procedure. The hind limbs are assessed in a similar way. This assessment starts in the pelvic region, beginning with the gluteal muscles. Next, the thighs and the lower leg muscles are palpated from cranial to caudal. Whereas in Europe we start at the hip area, the US and other countries start this routine from the distal part of the limb. In order to assess the back muscles, place the open hands flat on the back to the left and the right of the spinal column and palpate cranial to caudal from the neck to the tail. The object is to assess the general condition, symmetry, tenseness, pain, and temperature of the back muscles. There are further special diagnostic tests to evaluate the back. The skin fold rolling test is performed at the beginning of the examination procedure and provides important information regarding tension and problem areas in the muscles. Grasp a roll of skin in the sacral region between the thumb and the index finger of each hand. Now displace the skin fold in a caudal to cranial direction with the hands positioned lateral to the spinal column. In the presence of muscle tension and/or pain, it is difficult to lift a roll of skin from the deeper underlying structures. This increased skin tautness is caused by altered connective tissue turgor and increased muscle tone. Palpation of painful points. Starting at the neck, press the thumbs into the muscles left and right of the spine, gently at first, then gradually increase the pressure. Next, slide the thumbs downward, caudally, roughly the width of a vertebral body, and repeat. For detecting reduced spinal mobility as well as for treating vertebral blockades, the spinal process maneuver can be performed. The spinous processes of the vertebrae are grasped between the thumb and the index finger or between the thumb and middle finger and are displaced in the vertical and horizontal planes with gentle vibrating movements. Stroking is a superficial tissue manipulation technique at the beginning of a massage session. As a rule, stroking movements are made in the direction of hair growth. Stand beside or behind the patient and place the open hands flat on the muscles, starting from the neck. Stroke the muscles gently and not too rapidly, proceeding from the neck, down the back, and to the croup and hind legs. Grasp each leg with one hand and glide the hands downward. After reaching the feet, start stroking again from neck to feet. It is important to maintain physical contact with the animal when moving from one part of the body to another. Stroking is normally carried out with the animal standing, but can also be used in a recumbent patient. When kneading superficially, a roll of skin and subcutaneous tissue is gently grasped, thereby raising it from the lower tissue structures. Kneading gently stretches and mobilizes the skin. After grasping the roll of skin, release and slide the hands forward to the next segment, then grasp another roll of skin. To treat the back, place one hand on either side of the back or place both hands on the same side. Knead in the direction of the muscle fibers in the first case and opposite to the fiber direction in the second. Proceed from tail to head when treating the back and from distal to proximal when treating the limbs. Kneading deeply comprises a direct muscle treatment. Place the thumbs on one side of the muscles and the fingers on the other. Now alternately open and close the hands, kneading the muscles between the thumbs and fingers. You can start kneading gently and gradually increase the pressure. Like kneading, friction can also be applied deeply or superficially. Friction can be used to treat localized or large areas of the body. To treat a large area, place one or both hands on the muscles with the fingers slightly bent so that the fingertips touch the skin. Now gently slide the hands back and forth, either in or against the direction of the muscle fibers. To treat a small, localized area, slide the bent fingers in a circular pattern over a small area, thereby displacing the skin. Start with gentle pressure and increase gradually to reach the deeper layers of muscle. Pressure can be increased by placing the fingers of one hand on top of those of the other to assist the massaging hand. Circular pressure is used to treat small, focal zones. Gently press the thumb or fingertips onto the treatment site and move with small circular movements. Increase the pressure gradually to reach the deeper tissues. Shaking is a superficial technique used to relax the muscles. A local muscle group or entire limb can be treated by shaking. Loosely grasp a muscle group or an entire limb in one or both hands and gently move back and forth and shake gently, respectively. Tap the muscles gently with the hand slightly cupped, clapping, or with the edge of the hand, hacking. Clapping should produce a hollow, clapping sound. The intensity of treatment depends on the force applied, but also on the stiffness of the wrist. When the wrist is held stiffer, the taps are harder. This is especially useful when treating large muscle groups. For passive range of motion exercises, it is essential to maintain comfort of the animal. The limb proximal to the joint is stabilized and the limb below the affected joint is grasped and gently moved. The closer the hands are placed to the joint, the lower the forces will be that are applied to the joint. Over the course of several seconds, a joint is slowly flexed until there is the first indication of discomfort. Then, over the course of several seconds, a joint is slowly extended until there is the first indication of discomfort. Under no circumstances should the animal vocalize in pain or attempt to bite. In the following section, gentle flexion and extension of the following joints is shown through their comfortable range of motion. The hock, the stifle, the hip, the carpal joint, the elbow, the shoulder. Working with cats requires more patience. However, cats do tolerate physiotherapeutic exercises very well. The hawk, the stifle, the hip, the carpal joint, the elbow, the shoulder. The limb proximal to the joint is stabilized and the limb below the affected joint is grasped and gently moved. Over the course of several seconds, a joint is slowly flexed until restriction is detected. Flexion is held for 30 to 90 seconds while continuing to gently stretch. Stretching is often combined with passive range of motion exercises